Telemedicine is a convenient and effective means of offering healthcare services to patients who can't have traditional in-person visits with their doctor. The adoption of telemedicine in the medical community and acceptance by the general public were already on the rise when the COVID-19 pandemic started. Not surprisingly, telemedicine quickly assumed a prominent role in the delivery of healthcare during the lockdown. Now, hopefully, most medical practices have returned to seeing patients back in their offices. Even so, telemedicine will continue to serve as a valuable adjunct and/or alternative to in-person appointments. So the term telemedicine, or the broader category of telehealth, implies that the encounter between doctor and patient is only over the phone. Today, we actually have robust, secure, HIPAA-compliant video technologies which can closely mimic the experience of a non-procedural office visit. These platforms are typically device-independent, meaning patients can connect using a wide variety of phones, tablets, laptops, or desktop computers. Sure, CVR offers two types of virtual care. Our telemedicine service involves virtual visits where the patient is usually at home, but could also be at work or other non-clinic locations. The CVR provider communicates with the patient through a video connection. If the patient doesn't have access to a video-capable device, then we connect through a phone call. This type of appointment can be used for established patients who have already been seen in the office and are subsequently eligible for a virtual follow-up. We also offer free screening appointments. These virtual visits are meant to triage patients seeking vein care. The provider can appropriately direct those who may only have cosmetic concerns versus prospective patients reporting symptoms more consistent with medical vein disease, i.e. venous insufficiency. The other type of care we offer is that of virtual providers. In this case, the patient is still physically seen in one of our clinics, and the telemedicine team fills in for the provider who would usually be there. This capability means we don't have to limit schedules or close clinics in the event of staffing shortages. While the demand for telemedicine is growing rapidly, and it's certainly possible that our office-based clinicians may participate to some degree in the future. Currently, the telemedicine service is comprised of a team of dedicated, highly trained and experienced advanced practice providers, along with supervising board-certified physicians. This structure allows for a focused approach and enables us to optimize the clinical staffing and scheduling by virtually seeing those patients who are eligible for telemedicine. Telemedicine thereby opens up office appointment capability or capacity for patients who are genuinely in need of an in-clinic visit. We do recommend that our virtual patients conduct the encounter from a quiet, private location with access to a reliable and secure cellular or internet connection. If the patient does not speak English, it's tremendously helpful if a translator accompanies them. Otherwise, we can provide a translation service. It is usually a good idea to have some notes available for reference. Most patients presumably know what their concerns are, but can sometimes forget to mention or inquire about things during the visit. If a patient has a history of previous vein treatments, having that information handy is also very helpful. Yes, at the current time and for the foreseeable future, telemedicine services are covered by insurance. When our patients are scheduled for their appointments, we obtain their insurance information so we can verify their benefits and coverage. I think the future of telemedicine looks really promising. It will be a while before holographic doctors become the norm. Still, we can expect continued refinements in existing communications technologies, which will help narrow the perceived gap between the clinical value of an in-person versus virtual evaluation. The telemedicine team at CVR is continuously monitoring ongoing advancements in the field and actively incorporating them into our practice. Our goal is to continue to offer the best experience and best patient care possible.